I'm Cassidy.
I'm Anna.
I'm Faith.
And I'm Brianna.
Today we are raising awareness for SMA.
SMA is short for spinal muscular atrophy.
SMA is a group of inherited diseases that cause muscle damage, weakens strength, and other harmful things.
Unfortunately, SMA gets worse over time and eventually leads to death.
SMA is a rare disease, but is the most common genetic cause of infant death.
1 in every 6,000 babies are born with SMA.
What's even scarier is that 1 in every 40 people are carriers of this rare disease.
Being diagnosed with SMA is a 1% chance.
7.5 million people in America are carriers of SMA.
My cousin James is 3 years old and was diagnosed with SMA within 7 months of being born.
James is one of the 10% who lived after the age of 2.
We will read the interview with questions and answers from Anna and her aunt.
What type of SMA does James have?
Type 1.
When did he get diagnosed with it?
7 months old at diagnosis, but symptoms started presenting themselves around 4 months.
How often does he go to the doctors?
Doctor appointments vary. We try to treat over the phone when possible and keep in-office visits to limit his exposure to all germs. James regularly goes to the ENT doctor to check his track every 3 to 6 months. SMA clinic, neurology, preliminary, PT, OT, nutritionist, and regular doctors are all present, every 6 months to a year. He does, however, have a therapist that comes to the home a few times a week. He has one physical therapist, PT, that comes once a week, a different PT that comes once every other week, a teacher every other week, technology speech therapist every other week, a different speech therapist on the opposing every other week. And we are going to be adding in an occupational therapist again shortly. Not sure other than frequently.
How much does it cost monthly to take care of him?
Our monthly costs aren't greatly affected because of good insurance coverage. Granted, our electricity bill is quite high. We have to keep the house cool because he can't regulate his temperature easily. The financial burden tends to be large purchases that take a long time to get down.
How often do you need to be around him?
James needs constant attendance since he can't move his own mouth, nose, or talk to call for help. Someone needs to be close to take care of him for that. He also needs to have someone to perform all movements for him.
Is he able to go outside alone?
He can go outside, though it's a long process to do it safely. We do have to be very cautious of the weather. Temperature is a big factor. With little movements of his legs, his circulation isn't great. His lower legs get very cold easily in the winter. On the opposite, he can heat very quickly at the core because he is constantly working so hard to breathe. Moisture in the air plays a part as well. If it's raining, we need to be careful of his equipment doesn't get wet because it's electrical. The moisture affects his snot and drool. We can see the side effects of a rainy day for many days.
Okay. What type of equipment do you use to take care of him?
Ventilator, 2 so we have a backup if one should stop working. A humidifier for the vent. Cough assist simulates the inhale and exhale of a cough. Portable and stationary suction machines. Cool mist machine provides moisture to the lungs. Nebulizer, feeding pump, feeding tube, oxygen concentrator, and tanks for travel emergency. Medical stroller, wheelchair, PVC, bridge gym has stretchy bands to hold his arms in so he can move his arms a little bit independently. Bath chair, braces to keep his legs straight, and switches that plug in to modify toys for him to play with. We're working on getting a specialized computer that will read his eyes, gaze for communication. New brace for his feet, ankles, torso to support his spine from curving. In the standard contraption, he will be strapped in and slowly angled up to a standing position to give weight bearing on his feet. I think that's something. People with SMA are discriminated against. They are made fun of for not being able to move, drooling on themselves, and having weird body structure.
Type 1 is the most severe form of SMA, and it strikes infants from the day they were born to 6 months of age.
Type 2 affects infants from 7 months to 18 months of age. They're at increased risk for complications from respiratory infections.
Type 3 is the least deadly type of SMA. It affects children as early as 18 months, but can surface as late as adolescence.
Type 4 is the adult form of the disease and can affect anybody after the age of 35.
If you know someone with SMA, give them more attention. You never know how long you will have, so take advantage of them for the visits that you have, because you will regret it when they're gone.
SMA isn't something small, it's a big deal. Even if SMA is a rare disease, anyone can be diagnosed with it.
Raising awareness for this disease gives people hope and something to hold on to. Be supportive of people you know with the disease or a disorder like SMA.